Good morning, doctor. So I would like to introduce myself. My name is Eka Wijaya, last number 007. Now I will to describe about my article, the title about diagnosis and treatment GERD. We must know about the GERD. Okay, gastroesophageal reflux disease is defined as a symptom or mucosal gimmick produced by the abnormal reflux or gastric contents into the esophageal or beyond, into the oral cavity or lung. It is a common disease with a prevalence as high as 10% until 20% in the Western world. GERD can be classified as non-erosive reflux disease or erosive reflux disease based on the presence or absence of esophageal mucosal defection. GERD can manifest in various symptoms which can be grouped into typical, atypical, and extra-esophageal symptoms. Typical symptoms include heartburn and acid regurgitation, which have a high specificity but low sensitivity for GERD. Atypical symptoms such as epigastric pain, dyspepsia, nausea, bloating, and belching may be suggestive of GERD but may overlap with other conditions in the differential diagnosis such as peptic ulcer disease, aplasia, gastritis, dyspepsia, and gastroparesis. Lastly, there are various extraesophageal symptoms, including chronic cough, asthma, laryngitis, and dental erosion. From the symptom, no wonder that GERD have a profound impact on health related to quality of life. The diagnosis of GERD is typically made by a combination of clinical symptoms, respond to acid suppression as well objective testing with upper endoscopy and esophageal pH monitoring. GERD can some complication. There are erosive esophagitis, peptic structure, parent esophagus, and esophageal adenocarcinoma and pulmonary disease. Esophageal adenocarcinoma is thought to be more common in older with elephants body mass index, and screening for Barrett esophagus is recommended in this group. GERD is a chronic disease that typically requires long-term management in the form of lifestyle modification, medical therapy for a subset of patients, and surgical therapy. Lifestyle and diet modification traditionally have include weight loss, head of bed elevation, avoidance of negative meals, and elimination of trigger foods such as chocolate, caffeine, and alcohol. In medical therapy, the mainstay of treatment of GERD is acid suppression, which can be achieved with several classes of medication, including antacid, histamine receptor antagonist, or proton pump inhibitor. And surgical therapy is the last treatment for GERD. The indication for using this treatment is unwillingness to remain on lifelong medical therapy, intolerance of medical therapy, medical refractory symptom with evidence of GERD on endoscopy or pH monitoring, or GERD in the setting of a large hiatal hernia. That's all my about presentation. So before I'm close presentation, the last sentence of GERD is common disease that often found around all of us. So I think it's important to explain about this disease. And thank you very much for your attention, and see you.